I was a practicing physician for 15 years, as I mentioned to our witnesses beforehand. I've taken care of all patients regardless of their ability to pay, which is what we do in healthcare. But I just want to highlight that all is not rosy with Medicaid. And I know this hearing is about waste and fraud and abuse. But I'm from Indiana, and our medical practice routinely wrote off hundreds of thousands of dollars from a neighboring state's Medicaid program in billings every year because they ran out of money before the end of the year, and this predates the ACA. The other thing is that the program within our own state has been financially challenged historically with a significant Medicare provider cut within the last 10 years just to stay afloat. That said, Medicaid is a critical program that we have to have for our citizens. What can we do? Well, Indiana has expanded our Medicaid program using an innovative plan called Healthy Indiana Plan 2.0, and I'm hopeful that this state-based plan, as well as state-based plans around the country, can be used as a proving ground to how to move forward on our Medicaid program. Some facts about the Medicaid expansion that are not surprising to me, but it seem to be surprising to those who wanted to expand traditional Medicaid, is that ER visits are up, and in some cases dramatically up, in multiple studies across the country. And the hospitals are very happy, but we have made no progress because this is the highest cost form of medical care available in the country. And so, you know, having a card in your pocket but having no access to primary care physicians or others outside of the emergency room is not progress. And the encouragement to seek preventive care, as was mentioned earlier, may be technically true but functionally not accurate because you can't get preventive care if no one takes your coverage. States that have expanded Medicaid have already started to look for ways to pay for the program once the federal money for the expansion goes down to 90%. And my concern is reimbursement cuts will be the way that will happen. And what does that do? Further limits access to the citizens in their states. And if anyone doesn't think that sometime in the future that that the federal government will look for a way to pay for other things by further cutting that expansion money to the states on their Medicaid program, then I don't think, you know, you're not following the government very well. That said, I do have a couple of questions, and again, this is a very important hearing. I saw that. I mean, we limited the study, Mr. Begoyan, to the 4 states. Why did we pick these states, and did the GAO try to include other states in your study?
Thank you for your question, Dr. Bucshon. The way we picked our states is we began with the universe of beneficiaries per state. And then we also looked at data reliability as well as geographic dispersion. So those were the 3 key factors that we used to pick these states. Data reliability being a very important factor. We don't have reliable data, we can't do our analysis.
And that segues into Dr. Eckerl. How do you envision, well, the data we were just talking about not accurate from states, how do you envision the progress we're making in information sharing on Medicaid between the states and the federal government? How can we improve on that situation? So if in the future we want to study this situation, we can pick any one of 50 states. How are we doing?
Yeah, thank you. I think that's a really important question. Data is really central to program integrity work. What we have found is access to the right data set can really increase the sensitivity and specificity of our leads. The agency has made some of the biggest investments we've ever made in improving Medicaid data assets in programs like TMSIS, which is seeking to dramatically increase the amount of data and the kind of breadth of that data that we get from state programs. In addition, Congress has funded previously programs like the Medi, which encourages Medicare and Medicaid data sharing and integration specifically for program integrity purposes, and we've been engaged in that process for years now.
Is proprietariness amongst different systems a problem? I mean, what are the barriers to, you know, it seems like it'd be simple, right? But there are barriers.
There are, and I'm not a technologist, but there are clearly differences between systems and getting data integration to occur. That's not a trivial task at all, especially, you know, amongst 50 different states. So yeah, there are some real technical barriers to getting the right data formatted in the right way so that it's readily accessible.
But some of it's not just about money, right? Where the systems don't want to communicate because of proprietary control over data?
I'm not sure how much proprietary issues stand in the way. I think it is more technical implementation. And then, yes, resourcing is important to make sure that we can adequately make this all work together.